Hi, everybody. It's Kevin Sabet, the president of SAM. There's been a lot of talk about safe, quote unquote, safe snorting supplies or safe smoking supplies, crack pipes, etc. No doubt a lot of it's been weaponized in a very partisan way, in ways that are discriminatory and unhelpful. But I think the reason why there has been an uproar by at least some quarters, especially in those representing prevention, treatment, recovery, law enforcement, and other sectors, is because we're seeing how this really isn't about getting people into recovery. And there's sort of this false dichotomy that gets perpetuated that it's either harm reduction or treatment and recovery. We need to think about harm reduction as a bridge to recovery, as a bridge to treatment, as a bridge to healthcare, as a bridge to all kinds of things to help people's lives, with the goal, ultimate goal being recovery. And I think that's often lost in the discussion because it's seen as something that is an end of itself. And I don't think it is an end of itself. The other issue with it is that this is not, this is something that is honestly so small in terms of impact and funding, and it distracts us from larger issues that actually could move the needle in a much more important way. So every minute we keep talking about safe injection supplies, safe crack kits, et cetera, we are taking away from talking about comprehensive systems-wide change that can actually make a dent in this horrible addiction problem we have in our country. So it actually kind of annoys me that we have, set so much time and there's been so much print and ink, focused on this issue. And I get it; it's a sexy issue. It's kind of outrageous to think the government would be funding anything to facilitate crack, and it is outrageous. But we have to think of it, kind of zoom out a little bit and understand that really talking about that takes away from overall strategies. And at the end of the day, when we do implement harm reduction, we not only want to meet people where they're at, which is the old mantra of harm reduction and early advocates, but we want to meet people where they're at, but don't leave them where they are. And that's the mantra that I try and live by. We have to remember harm reduction comes from public health. And I think it's been hijacked and weaponized by some advocates of overall drug use to say that, it's not really about public health anymore. It's really about I can do whatever I want and I'll do whatever I want whenever I'm ready. And you can't tell me that drugs are bad in any way. And that's a problem. I think we need to talk about this in context of getting people into recovery if we talk about it at all. But it's taking away time from things that I think are a lot more important that can make a big change. And no wonder we continue to have the addiction problem we have because we're focused on these minutia and we're not thinking about also the next steps. Narcan is another good example. Narcan is absolutely needed. You have to be heartless not to want people to have overdose reversal, but we're not talking enough about what happens after Narcan, what happens to get people and to change their life. Absolutely, you need to keep that person alive. Otherwise, they have no life to change. But what happens afterwards? And sometimes we're so myopically focused on these silver bullets that we're not thinking really with a greater picture. We're not really zooming out to make the difference we need. Thanks.